Thank you very much indeed. Right, let's look at some texts and emails from the first hour. A very heated, as you probably heard, conversation about the NHS, which started off just talking about whether you'd be happy to wait longer, but actually got into something very interesting once Dan called in, who's a consultant with 30 years experience, and talked about actually these lists. And now this is not going to be the case for all disciplines within the medical, or should I say under the medical umbrella, because of course some are not relevant to necessarily private practice. I've just had someone tweet me actually who has talked about this and said, for instance, care of the elderly or paediatrics, not much private income in that respect, but say dermatology or ophthalmology, for instance, there can potentially be that. And I found it very interesting, and I'd be interested to know what you think when Dan said, you know, a consultant can do 13, I think he said, operations privately in the same space of time. It could do 4 on the NHS. Now, what do you think of that? Now, of course, they're getting paid a lot more, and I doubt there's many people out there who would suggest that nurses and doctors shouldn't be paid more than they currently do. But of course, that has to be funded from taxes, and then those taxes have to be taken away from somewhere else. But it was interesting, wasn't it, that conversation? Because ultimately, certainly from Dan's perspective, not from Dr. Kishan Rees's, but from Dan's perspective, it was about incentivising, as he said. And then once I pushed them some more, that incentivising became about bonuses. And of course, what do we know about bonuses? It means money. It means that, but then you get into a scary place where that could be construed or misconstrued as being, well, if you pay us more, we'll work harder, which of course is not the case, because there are plenty of very hard-working, diligent members of the NHS who don't do it just for the money. But then, of course, you could argue, why shouldn't they go to where the money is? After all, if you work in private business and you're offered a contract for one job which pays less and a contract for one job, same job but pays much more, you're going to focus on the one that pays you much more, aren't you? I mean, that's human nature, isn't it? Anyway, lots of texts and emails and also WhatsApp as well. This WhatsApp message said, a first world country should have a first-class health service, not the omni-shambles the Tories are turning it into. Wait longer for essential operation. I guess we'll just have to not get old or die quicker. Need some more money. Need some money, NHS. Scrap Trident already. Dips in Leicester said, our morning, non-emergency operations are on the increase, but there has to be a safe equilibrium, let's face it. But what this is an accident and emergency. There's a lot of increased people out on the tiles, drunks and troublemakers, nights out, males and females. Personally, there should be a fine imposed for admitting these people in accident emergency. Personally, think this is not an emergency, which is putting our hard-working NHS doctors at a lot of stress and burdened over some irresponsible drunks. Nursing staff concerned over stretched schedules with their work respectfully at the A&E. Also, as well, of course, I don't know if you know this, but Guy's and St Thomas's, their security people have started to wear body cameras. You know, that shows on a Friday, Saturday night how potentially dangerous it can be to work in A&E. Jazzy in Bournemouth said, NHS, too many chiefs, not enough Indians. There's quite a few Indians, to be fair. Too many managers taking up too much money needed for frontline staff. That being said, yeah. Sonna from Derby said, the problem is the government's strange taxing policies too. I can receive private healthcare through work, but it's deemed a benefit in kind, so people won't take it up, so it's back to the NHS. Had it not been that way, people would opt in, and that would share the burden of the NHS. Also, runway demand for NHS curative treatment must be counteracted by us well in advance of getting ill. We need to adjust our lifestyles to include better diet, more exercise, and web research for informed alternative medicines. Yeah, I mean, that's the thing, isn't it? Prevention. That's a good point. This tweet by Brown Sugar said, NHS funding as a portion of GDP down since 2010. Hell, we're below Greece and most of the EU on that. Intentionally done, around 8%. Most of the EU around 10%. It's not that NHS is overused, it's that it's undercut and underfunded. Can't get a doc's appointment? That's not immigration, the Mail Sun will tell you. It's over 500 doctor surgeries closed since 2010. Thank you very much indeed for all your feedback. Very interesting that hour. You learn things all the time, don't you, about the NHS, different things. And, you know, it's important to say, isn't it, and I'm sure you would concur, that the people who work in the NHS do an incredibly difficult job, and they're there to save lives, and they do it under the most trying circumstances sometimes, and we salute them for doing so. But that doesn't mean, of course, that they are above criticism. They are not. Nobody's above criticism, least of all me, as I only know too well. It's 11:10. Let's take a break now for some music. We've had a lot of talking.